welcome. We've got the amazing Anna, my friend, colleague, and an amazing women's health physiotherapist. I feel honoured to know you and have the opportunity to share you with all these lucky women that are watching. So we've been kind of on this mission for quite some time together and travelling this pathway. And I wanted you to really share a little bit about yourself and the work that you do, and really why women need to do their own myofascial massage for themselves. Because if you've never heard of it, or you don't know anything about it, you don't know you need it. So it would be really good for women to know why.
Okay, well, it's really as simple as scar tissue causes tissue tension. It causes tissue to get stuck and stiff and be tighter and less pliable than it was. And 90% of women that have had a vaginal birth have got some degree of scar tissue going on in their pelvic floor, and then that tightness and stiffness that then will happen around a scar. It's a guarantee. You have a scar, it will cause tissue tightening and tissue tensioning and tissue stiffness through the scar, and then that pulls multi-directionally through the whole system. So if that's you and you've got a scar, that is going to be affecting your pelvic floor function. It's going to be affecting how pliable it is, and so how reflexive and responsive it is. And again, if you haven't got the correct amount of elasticity, then you can't have the right balance, and things are going to be pulled out of line, or pulled into a way that they're sore or uncomfortable, or pulling into the back. So it's really important that we tackle this tissue tightness and tissue stiffness. And I think in recent years we've become more accustomed to saying, oh, she has a C-section scar, there's the tightness, there's the tension, there's the stiffness that we can see, so we should work on that. And that's become more mainstream, but we're not seeing these vaginal pelvic floor scars, but they are there and they are having effects.
And many women don't actually know that they have scar tissue there. I want to just rewind to 90% of women
that have had a vaginal delivery
have scar tissue. That's massive. And most women start with me, certainly in a Pilates context, and they say, oh yes, I had a normal birth. And with some follow-up questions, we then discover they had a tear and an episiotomy, and it's been normalised that's just part and parcel of it, and it's not managed.
And things that will increase the tightening and tensioning up of that tissue include anything in those postnatal weeks, like I had an infection in the wound, the stitches broke down, actually it was really painful for weeks to months. If that's part of your story, then even more we need to say what's happening around that scar. Also, for some women that don't have any pelvic floor scar tissue, there can just be a tightening and a tensioning up anyway. This can be due to any number of factors. It can happen during the menopause, and tissue just becomes drier and stiffer, so that's actually a really good time. If you haven't massaged up to the menopause and you're starting to feel some vaginal symptoms, it's a great time to start a little bit of massage. It just softens the tissue, soothes the tissue, increases the pliability, increases the elasticity, and that's what we need.
You use the word pliable and pliability a lot as you're describing this, and I think that a lot of women come and think that they're weak and need to get strong. So this idea of pliability, why is that important?
Because everything needs to be nice and pliable and elastic to have the correct biotensegral balance. I'm sure you've explained about biotensegrity. So in order for us to have our correct biotensegral balance, everything has to have the optimum elasticity. So the way that problems come along is if you have less elasticity, otherwise known as stiffness, and by having too much stiffness somewhere, you get these pulls through this three-dimensional stretchy web, and then you have less stretchiness, and then you start to see problems. So in terms of prolapse, what I've seen through my research work is that if you've got some tightness, tension in the pelvic floor, which yes, for many women is a scar, but not everybody. If you haven't got a scar, don't discount this. This could be you as well. That scar tissue literally pulls on the organs and pulls the rectum or the bladder out of alignment, which gives you prolapse symptoms and is a prolapse. So by reducing the tissue tension in that area, reducing that stiffness, then the bladder and the rectum and the cervix can move back into a happier place.
I love that, into a happier place. And I've worked with a lot of women who haven't had children and have had prolapse from the hypertonicity. So from an extreme case of the lack of pliability, and so it really isn't just, like you say, it really isn't just if you've had children or an injury, a birth injury. It's really important.
That tightness and tension can come through postural habits, through anxiety and stress and all those emotional things. It can come through injuries to other parts of the body. One good way to do it is to have an injury to the leg, which then causes you to limp, because the only way to limp is to grip through one side of the pelvis repeatedly. So there you go.
I can hear pennies dropping as people are watching this now, because we don't sort of appreciate generally just how much everything we do feeds into and out of our pelvis.
Our pelvis is our centre of ourselves. So it's going to feel the effects of anything else going on. And our pelvic floor, all of the muscles and soft tissues in the body, is the one that is most responsive to our emotional state. So we can see these tightnesses and tensions and stiffnesses coming in through, a lot of things. It can be overuse, lots and lots and lots of marathon running in elite sport. That would be another way to just tight. Sorry. And things just get tighter.
Gymnasts and horse riders often. So it's also the idea of walking is really, really important for the function of the pelvic floor, to help the elasticity and all of our postural habits from everyday life. So I think that's really, really useful for people to understand why they need to massage. What do you kind of mean by massage then?
So massage in its in its simplest form really just means working the soft tissues with your hands in order to soften them and release any stiffness. And so myofascial release means releasing or changing the state of the fascial tissue, which is our connective tissue, and that's something that people will go and do training courses and learn how to do myofascial release, which is it's a very gentle type of touch which allows the connective tissue to soften. Thing is, we don't have enough people in the country that do myofascial release, full stop, let alone enough people that do myofascial release for the pelvic floor. There's just not enough out there. But good old bog standard straight up massage, when we're talking about these scars and this pelvic floor stiffness, can be just as effective. And then you're not tied to having to go see a practitioner every couple of weeks and spending, 50, 60, 70 pounds. Actually, if you can take control of this and you do your own body work, you do your own massage, actually you're the one in control of it. You can do it little and often. It costs you nothing. You can take control of the situation now. You're not getting put on a waiting list. You can just make a start. And, just so everybody knows, everyone that does come and see me gets taught how to massage, and they get a very, you need to do your massage, you need to do your homework, because you're only here, perhaps once a month, something like that.
It's the same with Pilates. People come and see me maybe once a week, and I have people who travel and they come once every 2 or 3 months. They have to have homework to do, and if you don't do the practice, then it doesn't accumulate the results that you want. And it's exactly the same with us. And I think with the massage, we need to take whatever that stigma, that thing is that stops us from doing it. We need to really dissipate that.
Well, I think some of it's stigma and some of it is trauma.
Yes.
Let's not forget that the reason why these scars are there so often is due to a traumatic event. And I do meet a lot of women who find it very difficult to make that leap. They come, they have the assessment, and I might do some work, and they say, right, okay, now this is how you need to do this yourself. And there's And actually for some women, but if I'm touching that, then I'm remembering what happened. And if I'm touching that, I'm having to revisit that birth story that's really painful. And what I say to them is, but you're reclaiming health through this touch.
That's a beautiful.
That injury is there. That injury is there whether you look at it and touch it or not. And if you try and bury your head in the sand and say that injury's over there, but I'm not going to look at it and I'm not going to touch it, then it's just going to keep on pulling and tugging and causing you those problems that you wish you didn't have. Whereas if you can be kind to yourself and go slow, take it at the pace that you need, but essentially take that step to go, I have an injury, I have a scar, it hurts, it doesn't feel how I want my tissue to feel, it's uncomfortable, it doesn't feel natural, it doesn't feel how I used to feel. And so what I'm going to do is touch it daily to heal it. I'm going to touch it daily to soften that scar, to rebuild my health, to soothe that tension. And yes, at the beginning of that road, you might need to have a box of tissues handy, and you might need to go and have a cuddle afterwards, and it might be, you know, there might be some sadness comes up, you know, that really does happen when we do body work to the tissue, when we massage tissue.
Even in movements,
yeah,
it happens.
Emotions come up.
They do.
But this is a way that you can take that trauma, take that pain, and heal yourself, take control of it to heal that tissue. So I really think it's really...
and reclaiming yourself.
Yeah.
That's been a big bit of my healing journey, is actually from my traumatic birth, where things were taken out of my control. Doing this work, the massage treatment for myself and the movement work, is me taking back control in a compassionate way and with grace for myself and for the experiences that I've had. So I think that, you know, we've both worked with a lot of women where the traumatic birth story is huge, and it really influences many things in our onwards life.
But like I said, take control of it. Take control of it.
Great opportunity.
Another barrier, I think, is pain. So sometimes, so for not everyone, sometimes you can start the massage and you can kind of come in at a sort of aching tenderness point, and that's easier, and I know that's easier than for those women who, when they start the massage, they're starting with a kind of fiery, scratchy discomfort. And I know that's harder.
That is harder,
however, just a little bit. And it might be that you need to do some weeks where all you're actually aiming to do is touch. All you're actually aiming to do is get a thumb on and touch, and holding that there. And just that action will desensitize, will start, so that pain, that discomfort, that scratchy sharpness comes from this adhesion where all the tissue's really scrunched up against itself. And even just really gentle touch will just start to just allow that tissue to become, it'll still be tight, it'll still be stiffer than we want it to be, but just some of that real fiery sharpness to pass. And then once you move more into that tender, achy, bruisey zone, it is much easier to handle.
It's also feedback, it's information your body is communicating to you and educating you a little bit more
Here's the
on your body.
Yeah.
And you know, something that's really important to me is reframing and the language that we use around things.
And here's another thing that makes me cross, and I'm sure this makes you cross as well. But another story that I see far too often is women coming along and saying, oh well, I've been looked at and whoever had looked couldn't see anything, and so essentially they've suggested that it's all in my mind. Like, okay, so did they actually feel into this tissue? Because, you know, when you look at the vagina, there's not necessarily anything to be seen there, but it's supposed to be really stretchy and pliable tissue. So did they test the pliability? Did they test the stretch? Did they feel and palpate into this tissue? No? Okay, you want to do that yourself? Oh look, the problem is in your vagina. It's not in your head, it's in your vagina. You knew it was in your vagina, and once you've located that place that hurts, that even though it is painful, even though it is difficult, it validates what you know deep down, which is that the problem is there.
Yeah.
You know, for so many women, they know deep down that's where it's all coming from. So really what we're saying is, yes, it is.
Yeah.
The place where you feel it's all coming from
is
where it's all coming from. So what we're going to do is take hold of that place where you feel it's all coming from and just give it some gentle, soothing, healing touch. And even if that means starting with just the lightest, most gentle touch, and thinking massage is later down the line for you and all you're really doing is desensitizing, great, brilliant, start the path.
I feel like it's important to highlight that less is more idea, because just in lots of things in life, we're kind of rough and ready with ourselves, but we'd be much gentler with somebody else.
Yeah.
So it's giving ourselves the sort of approach.
This is it, which is why I will very often say, you know, make sure that you've got a hot chocolate or a glass of wine or whatever it is, or your favourite podcast or whatever it is that is going to make something that feels difficult, that feels like it might be uncomfortable, that feels like it might bring up old trauma, you know, anything, any feelings that you've got, you know. Again, shame is such a common one that people have with pelvic floor problems. Again, that's not because of reality, that's because of societal constructs. You're like, actually, you know, 90% of women who give birth vaginally have scar tissue. Why is there any shame around that? We just need to take hold of it and go, come on now.
Literally.
So be kind to yourself. This isn't easy for everyone, and it does get easier. It does. As soon as you start, it gets so much easier. It becomes something that becomes second nature, that you can just do, and you will get
part of your routine.
Just exactly, build it into your routine.
And it really does, you know, and I think it gets easier quicker than you imagine. And it also gets easier in lots of different layers of who we are as women too, as how I experienced it, for sure.
And I think another thing is, people will very often say, I don't know what I'm feeling for, and people will always say that with an air of embarrassment. I didn't know, I didn't feel before, and I don't know. Well, again, not your fault. We didn't get taught any of this.
No.
And so it can feel really unusual. You don't know what the different lumps and bumps are. You don't know which ones are supposed to be squishy and which ones are supposed to be.
Correct.
But as a general baseline, if it feels like a gristly lump, or it feels like a guitar string, or it feels sore to touch, or it feels like a stuck ridge of tissue, you know, if it hurts when you press it, it pretty much needs.
That's a great kind of way of categorizing it, because we can all associate, well, is it gritty, is it what was the word you used?
Gristly guitar strings. So this is where, and we're going to come later to precautions, but actually here is a good place to just put in what I consider the biggest precaution, which is if you've ever had pelvic surgery, be that hysterectomy or any prolapse repair surgery. That surgery will dismantle what I just said, which is find a sore bit, great, work on it. Basically, once you've had pelvic floor surgery, I really do not think it's safe to embark on self-massage without being under the care of a physio who has assessed you in depth and with detail. Because once pelvic surgery has happened, and that's either a hysterectomy or prolapse repair surgery or any other major pelvic surgery, the anatomy has changed. So we can no longer make the assumption that if you massage the sore bit, the biotensable arrangement will improve. Essentially, without surgery being part of your history, we can make that assumption that if there is a tight, stiff, sore bit of tissue, if you work on that and massage that tissue is going to get softer, and then the body will return home. The shape and the orientation of the pelvic organs will go back to where their genetically predetermined place is, because there's nothing else in the way. However, if you've had pelvic surgery, and I'm sorry to hammer that point, but it's a big one, then what you need instead of this is
Yeah.
some individualised assessment.
It's really important to highlight that, because I even have women who wouldn't consider hysterectomy as pelvic surgery. So it's important to highlight that, and we will talk more about specific things shortly. I think that we've done a good job, Anna, of expressing the importance and the how-to kind of basics of pelvic floor massage. Is there anything else you wish women to know?
From this perspective, well, there's lots of things I wish women would know, but I think from this perspective, just that they can do it, that even though it feels hard and it feels like there's a lot of challenges in the way, just prioritising making that time and space, you can do it, and it will get easier, and things will get better.
Great. Thank you so much, Anna. It's great.
Right,
I know
fine.
people will really learn a lot from this conversation and hopefully take the steps to work on their own pelvic floor. Thank you so much.